Christina. I'm the occupational therapist here at Thompson Healthcare and Sports Medicine at our Linwood location. Today I have patient Rachel joining me. We are going to be discussing a little bit about what occupational therapy is in this multidisciplinary setting, what your treatment sessions might look like, and what we can do for you here. Okay, so to discuss occupational therapy a little bit, occupational therapy is an all-encompassing healthcare profession, treating individuals across the lifespan while focusing on achieving maximal engagement in daily tasks and activities. An occupation is an everyday task that we need or want to do, whether it may be getting ready in the morning, doing our morning routine, and taking your child to school, as well as engaging in routine exercise or sports activities. Occupational therapists, especially at Thompson Healthcare and Sports Medicine, strive to address patients' limitations, whether it may be with reduced range of motion, strength, muscle endurance, pain level, and inflammation to promote full participation in their day-to-day lives. Okay, so to start off an evaluation with your occupational therapist, first you need to get to know a little bit about your patient. I have Rachel here, and this is where I would interview her. Get to know her, find out her occupations and areas of potential dysfunction or limitation. So from interviewing Rachel a little bit, I found out that she is a full-time student and waitress, and sometimes she experiences a little bit of shoulder pain in her right shoulder, which limits her full ability to engage in these tasks. Rachel says she has difficulties lifting her waitress tray to about this area and up overhead, as well as she gets a little stiff when sitting down and engaging in prolonged typing, prolonged sitting, and doing her homework. So from here, after getting to know her a little bit, I would assess her range of motion, muscle strength, by conducting a range of motion screen and a muscle screen. Also, further testing may be indicated to assess her grip strength if she reports any type of weakness in her right hand, and as well as using my clinical judgment as her therapist. Okay, so now we're going to go into our range of motion screen. Rachel, just follow me and I'll be observing for any type of limitations or your just range of motion in general, okay? So we're gonna start with the neck a little bit. Look up to the ceiling and down to the ground. Look over your right shoulder, over your left. Bend the neck side to side. Good. Any discomfort with any of that? Okay. You want to be continuously checking in with your patient as they're doing these procedures. Okay, so then now we're going to look at the shoulders a little bit. So come up and drop it down. Circle back and forward. Good. Okay, now we're going to move on to the arms. So with both arms, you're going to raise and lift up. Good, and come back. Pull them back. Okay. You're going to come up and to your ears. All the way up as far as you can. Good. And then behind the head. Behind the back. Out to the side and give yourself a big hug. Good. Arms out straight. Curl and down. Flip the palms up and down. Good. Flick the wrists. And circles. Touch each finger. Very good. Okay, now we're going to move on to a little bit of manual muscle screen. So, as Rachel's right shoulder is the problem region, we're going to look at the right shoulder. So, what I'm going to have you do is bring your arm straight out in front of you. I'm going to apply a little bit of resistance downward. Fight my resistance, okay? Ready? Good. Keep it up. And then push, 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 push down. Awesome. Now you're going to come out to the side. Same thing. Push, 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 push. Good. And down. Good. Now you're going to bring your arm into your body like this. Okay? And I want you to push against my hand. Good. And out towards me. Awesome. All right, and that is range of motion and manual muscle screen. Okay, next step after we did range of motion and manual muscle testing, if it's clinically indicated for your patient, you may assess grip strength with the dynamometer. This tool assesses the individual's grip strength and you would use it at the initial evaluation, and you can recheck it at the reevaluation just to see how far along your patient has made gains. So with Rachel, I'm going to have you thread this through your right arm, put it in your hand, hold and tuck the arm close to your body. So when I say go, you're going to squeeze as hard as you can. Ready? Go. Squeeze, squeeze, squeeze. Good. Relax. I would record this initial reading. Reset. Go ahead again. Squeeze, squeeze, squeeze. And relax. Last time. Squeeze, squeeze, squeeze. Good. All right. Then I would take the average of all three numbers, and that would indicate her right grip strength. From here, if it's clinically indicated, other further testing may be appropriate based on the individual's condition or how they're presenting, such as special orthopedic tests, sensation testing, observation of any swelling, tenderness, or redness, and generally just watching the patient as they present. Okay, next step of the evaluation is I would like to see Rachel performing functional movement patterns with that right shoulder. Since I know that she's a waitress, she has to carry her tray around this height and up overhead. I want to simulate that as best as possible to kind of see where she might be experiencing some limitations. So, Rachel, I'm going to have you perform an overhead lift with this ball or waitress tray. So I'm going to have you walk over here. You're going to bring it to about this height, and then you're going to walk a few steps. You're going to turn and then lift it overhead to simulate your tasks at work. Okay? Good. Go ahead. Good. Now up overhead. There you go. Awesome. Next thing that we're going to do with the ball as well, I'm going to have you lift up overhead. So what I want you to do is press the ball up and then pass it to me. Okay? Ready? So I'll pass it to you first. Up and down. Now you lift up and pass. Good job. Again, simulating her functional movement patterns throughout her day. Okay, so from here, I would discuss with the patient where I've observed some limitations, whether it may be in range of motion, strength, muscle endurance, whatever it else may be, and ultimately make client-centered goals with the patient in order to fully maximize treatment potentials and patient outcomes. Here's where I would ask the patient, what are your goals for therapy? So we're on the same page for therapy, and we can work towards mutual goals together. Lastly, I would provide Rachel with any handouts or home exercise programs and relevant information for her to take home and review. Patient handouts may include a few home exercises or informational packets based on individual need, most common being safe and effective lifting strategies, as well as energy conservation. Okay, flash forward to the first treatment session. I'm here with Rachel. Initially, I'm going to be checking in with the patient and seeing how they're feeling, making sure to ask initial pain or discomfort level before our treatment begins, as well as recapping the goals we established from the evaluation, seeing if she has any questions. Then we'll get into the treatment, whether it may look like stretching, manual techniques, or exercises. That's truly dependent upon the patient and how they're presenting. Continually, I want to check on the patient, making sure they're performing their exercises properly, as well as monitoring pain or discomfort throughout, especially taking note to the post-treatment pain level. So, I'm going to perform a little bit of passive range of motion with Rachel, just to give our viewers a little bit of ideas as to how we'll start a treatment session. So, I'm just going to have you move your arm this way, and then back, and front. Good. We'll go out to the side, and down, and side. So then after we engage in some initial stretching, we would head to our exercises and recap what we did at the evaluation. Okay, so now here's where we would review a little bit of the exercises together to make sure that Rachel is doing these exercises safe and efficiently. Okay, so first exercise, Rachel, I'll have you hold this in your right hand. It's called a pendulum. So this is on your home exercise program. You're going to bend over and do 10 circles clockwise, 10 circles counterclockwise. Okay, go ahead and try a few of them for me. Good. Nice and slow, that's it. Perfect. And stop. So that was your first exercise on the home exercise program. The next one that you're going to do is, I'll take this, and you're going to do a threefold motion. So, arms out, you're going to make a Y, and then with the palms down, you're going to come up. Okay? There you go. And at home, if you don't have weights, you can use water bottles, cans, anything you might have at home. But for therapy, we'll use our weights. Make a Y. Good. And then out to the side. Awesome. I'll take these. Understand those? Yep. Okay. Last one. This is our third on the home exercise program. What you're going to do is you're going to take the small ball and you're just going to press up. Okay? Good. Again, making sure your patient is doing this effectively and safely. Alrighty. I'll send these home with you.
Thank you.
You're welcome. And let me know if you have any questions going further, okay?
Will do. Thank you.
And to recap, that is what an initial occupational therapy evaluation and first treatment session may look like for you. I would like to thank Rachel as my patient here with me today and thank the audience for watching. If you or someone you know would like to contact Thompson Healthcare and Sports Medicine, please feel free to do so at any of our locations. Thank you so much, and again, this is Christina, occupational therapist at our Linwood location.